And in World Vision, we're privileged to work in almost 100 countries across the world, and seeing and hearing from people like Queen, and able to try and listen and amplify their voices into parts of the world. And as we come up to the summit in September, we're going to be working hard across the whole World Vision International Partnership to take the voices beyond the normal London, Geneva, Rome and Washington, to let the voices from Kampala, La Paz, Dhaka and beyond speak to people that make decisions that will affect their lives. That's part of what World Vision is about here. As you said, David, I'm going to speak a little bit about MDG 4 and 5, and I'm sure you know what those are, and you will do certainly over the next few minutes. But before we do that, I just wanted to also look at the values and the principles that underlie the Millennium Development Goals. In that declaration that David referred to, the Millennium Declaration, world leaders stated that we recognise that in addition to our separate responsibilities to individual societies, we have a collective responsibility to uphold the principles of human dignity, equality and equity at the global level. As leaders, we have a duty, therefore, to all the world's people, especially the most vulnerable, and in particular, the children of the world to whom their future belongs. Now, as one of the biggest international development advocacy relief agencies in the world, World Vision has worked for many years before the MDGs with children like Queen, and will continue to do so way after 2015. But those values, human dignity, equity, equality, as a Christian organisation as well, those values are central to our beliefs, and I think that those kind of values are what drives many of us involved in international development. And it's refreshing from the time I first worked on a child survival project in Mauritania in West Africa 20-odd years ago, through to working in Asia for many years, including 8 years in Cambodia. I've seen donor trends, approaches, initiatives, programs come and go. Some have been good, some have not been so successful, some have lasted a long time, some have just been a passing trend. But I do think that Millennium Development Goals have been unique, are unique in a single rallying point for the whole international community in terms of fighting poverty and international development. And in being measurable as well, they also offer all of us as citizens in our own countries, wherever we're from, an opportunity to hold our governments to account in a way that some other initiatives may not have done. And with 5 years to go, I want to be able to come back in 5 years' time and hear Queen and her friends in her village be able to speak about things differently. And the question is, will they? What difference will it make these next 5 years? Now, we all know that the progress towards Millennium Development Goals is uneven, and that on current trends, they will not all be reached. And we also know that in the area of health is where the MDGs lag furthest behind, both in MDG 4 in terms of child mortality and Millennium Development Goal 5 in terms of maternal mortality. They are far off. In fact, only 30% of the progress needed to cut child mortality has been made so far. 24,000 children a day are still dying before they reach their 5th birthday. This is simply the worst human rights atrocity of our age. And it's not one that gets enough attention. I think we'd probably all agree with that. But not only that, the causes of that are vastly, mostly preventable. And in fact, the solutions are cost-effective, cheap, and fairly straightforward. This is what makes it a scandal, a global scandal that should not and cannot be ignored. Having said that, the risk of failure to meet MDG 4 that hangs over us, as it does over MDG 5 and some of the others, should not take us to a council of despair. There is signs of success, signs of progress in many parts of the world. Let me just speak. Malawi, for example, which is where Queen is from, has actually, despite being one of the poorest countries in Africa, over the last 20 years, has almost halved child mortality through fairly simple measures such as increasing the number of attended births, boosting immunisation coverage, and investing in better nutrition. This is partly possible because they had a single national health plan that got the backing and support of international donors in a unified way. So if we can take the lessons from places like Malawi, where MDG 4 is on track, and apply these to the many countries where MDG 4 is either showing no progress or little progress, there is hope. Now, World Vision would like to call attention to 3 areas particularly: nutrition, maternal health, and the prevention and treatment of the major childhood infections. Now, 35% of child deaths have undernutrition as a factor. It's a huge amount. And again, simple methods such as promoting exclusive breastfeeding, complementary feeding, vitamin and mineral supplements to prevent malnutrition and stunting, and better monitoring systems to pick up early signs of acute malnutrition can cut that. They can cut that number significantly. Maternal health. Now, luckily, we're hearing more about maternal health in these last few months. Our government and other governments have prioritised that. And we know that maternal health and child health are tied together at the hip for obvious reasons. In World Vision, we've seen many projects where investment in maternal health has yielded benefits both from maternal health and child health. Project I know in Cambodia saw huge proportions of huge increases in antenatal care checkups, more than double. Increased attended deliveries go up by 50%, increases in breastfeeding tripling, through simple interventions at the community level, through training and education of village-based health workers interacting with the lowest level of community health services. So that's maternal health. Then take to the prevention and treatment of the main childhood infections. We're talking about pneumonia, talking about malaria, diarrhea, HIV and AIDS, and others. Again, there's a range of simple, cost-effective interventions from hand washing, basic sanitation, safe water, rehydration therapy, and other things like that, which can hugely reduce the vast numbers, and I won't go unpack all the numbers that die from those particular infections. But so we do have a window, a narrow window maybe, but a window in this next 5 years to take the evidence and the lessons from places like Malawi and to accelerate progress in what the 30 countries that have the highest burden of child deaths, of under 5 child deaths. They account for 80% of under 5 child deaths happen in only those 30 countries. Now, money's not the answer alone here. We need more than that. But it is a necessary part of the answer. And in fact, far too many countries, about 18 of the 30 high-burden child mortality countries, only spend less than 10% of their national budgets on healthcare. So that is one of the answers. But then, similarly, many countries need fully funded national health plans from donors and international institutions. Beyond that, I'd say World Vision's focus, where we work, is we work at the lower tier of the health system and the interface between that and communities and families. And that is also neglected. Little attention is given to that level, despite the evidence that there are low-cost, easy-to-deliver measures that can have a decisive impact on child health, such as hand-washing, breastfeeding, and such likes. World Vision estimates that if you had a comprehensive package of household-level and community-level interventions, it could prevent 2.5 million child deaths a year from those. And despite the evidence for this, our governments and other governments often neglect these at the expense of the formal health systems. And what we need to see is a redefinition of health systems to include the community level, to include family and community level care, together with a fundamental shift in the public financing, public spending towards preventive measures over curative measures. Now, whether or not MDG 4 will be realised in the next 5 years depends largely on what happens in those poorest countries. But here in the UK and other richest countries in the world, we have our part to play in this. Not only should we continue to increase the levels of aid, But actually, we want to see better coordinated aid amongst donors. We want to see better predictability for recipient governments from aid, and we want to see greater alignment in aid with national health plans. Donors also, like recipient governments, need to broaden their understanding of health system, and it's been welcome to have a greater focus on health system strengthening in the past year or so, but they need to expand that to reach community and family level, household level care. World Vision has a campaign, a global campaign called Child Health Now, and we're calling on all stakeholders, whether they be students, whether they be governments, whether they be donors, academics, civil society, faith-based organisations, to stand up and do something to stop child deaths, so that Queen and her friends can come back in 5 years' time and tell us a different story than the one she told us this evening.
Okay, thank you, Justin. Carola?